This morning, as coronavirus cases continue to rise, there is an increased focus on the importance of testing, including testing for antibodies. I sat down with family physician Dr. DocSwiner to talk about the different types of tests and who should get them.
So the way that I describe it is the nasal swab, of course, the tickle in the brain test that doesn't look very kind. It's not. I've had it. It's horrible, but it's very important. But what it does is test for if someone has the acute infection, right? So they come in with the fever, the cough, the shortness of breath, now diarrhea, runny nose, sore throat, like there are more symptoms being added to the list. But they come in with symptoms, or they know that they've been exposed directly to someone who has COVID. So that's where I reserve those nasal swabs for.
Okay.
The antibody test, the blood work. So you come and get your blood work drawn through your vein,
Okay.
which you normally have to do at your provider's office. So you have to call your provider and see if they have it available. But that test is important to know not only if you've been exposed to the disease acutely, meaning recently,
Right.
but whether weeks or months ago you've been exposed and you don't have any symptoms. So it's very important to help identify who is what we call an asymptomatic carrier or a pre-symptomatic carrier, meaning you're right before you're starting to have symptoms and you don't know, because you could be a vector and allowing
know it.
Exactly, allowing the disease to be shared and propagated in your community unknowingly.
Now, DocSwiner also wants to remind you to talk to your doctor first before scheduling anything. You can schedule an antibody test at places like Walgreens and CVS, as well as most Minute clinics. We're going to put my full interview online after the show, and I love the way she explains everything. It's so simple.
Yeah.
So that way I understand what's acute mean, what does this mean, what does this mean. So I think that is so important, especially with this disease.
Well, and it's interesting, we originally thought this thing came over at one time period, and now we're thinking it's earlier.
Yeah.
I had an over 104 fever back around Christmas time and was out for about 2 weeks, and to the point that I was going to go to the hospital one night because I was more than 104, and now I'm wondering
if that's
back then, was that what it was?
Yeah.
So antibody tests can be very helpful. 525.
Testing is an important key to stopping the spread of the coronavirus. Now, North Carolina has made it easier for you to get tested. A new order allows you to get tested for COVID-19 without a doctor's note. Family physician Dr. DocSwiner recommends people get tested even if they are not showing symptoms.
It's of utmost importance, particularly from a public and community health standpoint, because we don't know. We need to know who has it. We need to know who's a carrier, who's transmitting the disease without knowing they have the disease. So it's very, very important to get tested.
There is some promising news on the vaccine front. Preliminary results from a University of Oxford vaccine trial suggest it is safe and induced an immune reaction in adults 18 to 55 years old. Now, it is just one of 23 different COVID-19 vaccines in clinical trials around the world. Now, while COVID-19 cases continue to rise across the nation, leaders everywhere are putting restrictions in place to help slow the spread of the virus. I sat down with family physician Dr. DocSwiner to talk about what needs to be done to move past the pandemic and when we could possibly see a vaccine.
What elements are important in moving past this pandemic? Is it more restrictions? Is it a vaccine? Is it a cure? There's so many different, as you've talked about, so many different things that combine and all here with us.
Yeah. So I still think testing is important because that lets us know what communities have been hit the hardest and where we need to be the most careful with our restrictions. As you all know, Mecklenburg County is the #1 county in the state. So we wouldn't know that if we didn't have testing. So that's number one, continue testing. Number two is a vaccine, which I'm very optimistic about. I have a lot of friends in research that are saying that we're having multiple trials in humans going on right now in the US. The results are looking good. So hopefully by January, maybe before then, we'll have an effective and safe vaccine available so we can all move forward. And then, of course, the cure, not just for the folks that end up in the hospital on vents, but for folks that get sick at home and aren't sick enough to be hospitalized. But hopefully, once we catch with their tests, becoming positive, we can go ahead and start some medicine as an outpatient. There are trials going on there. I know here at UNC and Duke, they are making a lot of movement toward coming up with a good outpatient oral treatment. So, we're moving in the right direction, but we still have a ways to go.
DocSwiner continues to emphasize how important testing is and says if you are looking to get tested for the virus and don't know where to start, speak with your doctor. You can watch my full interview on our website after the show.
I did the test, and it was I had to wait probably, I think it was 5 days, something like that.
Yeah, it's a little longer now just because of the backlog.
Yeah, absolutely. 7:43, let's get you